Hello, this is Dr. Tony Clark with learninganesthesia.com, and today we're going to talk about monitored anesthesia care, which involves anything from moderate sedation to general anesthesia, but typically involves just moderate sedation to deep sedation. So the different levels of sedation were discussed earlier in our ASA levels of sedation lecture, but briefly, moderate sedation entails that the patient has a normal response to verbal and tactile stimulation. Their airway is protected, their spontaneous ventilation is normal, and their circulatory support may or may not be impaired. So what is required for moderate sedation? So the ASA put out some standards, meaning thou shalt, things that we are required to do when providing moderate sedation. Number one is qualified anesthesia personnel. Number two is 4 important things shall be continuously evaluated. First is oxygenation. We do that by pulse oximetry. Next is ventilation. We do that by CO2 monitor. Capnography. Number 3, circulation. That's continuous EKG monitoring must be present, and blood pressure and heart rate must be assessed every 5 minutes. And last, temperature must be monitored when shifts of temperature are anticipated. So really, it's not that much different from a general anesthetic. You have a pulse oximeter. You have a patient on continuous EKG monitoring. Their blood pressure and their heart rate is being assessed every 5 minutes. The problem sometimes comes when you need to monitor CO2. If the procedure itself does not allow to monitor CO2, then you can use clinical signs. However, I strongly urge to use CO2 whenever available. What I typically do is take the CO2 monitor and I attach the normal tubing to it, and then I run that into the mask that the patient is breathing. You can hook this up to a mask very easily by using the catheter tip of a 17 gauge needle. Just the catheter tip. All right. One of the other things that's very important when providing moderate sedation, and I'll emphasize this on other lectures, is be prepared. Be prepared for the patient to go into deep sedation or general anesthesia where their airway may be compromised, their ventilation may be compromised, and their circulation may be compromised. So have backup plans should that occur. So how do you deliver moderate sedation? Well, there's multiple different ways to do that. The classic one was to give Versed or midazolam and fentanyl. Typically, I would give 1 to 2 milligrams for an average size adult of Versed and 25 to 50 mics of fentanyl for an average size adult. Other ways you can do that is by a propofol infusion. If you read the package insert of the propofol, you can get an idea of the best way to perform this. They recommend inducing M.A.C or moderate sedation with either 50 milligrams per kilogram bolus or starting the infusion at 100 to 150 micrograms per kilogram per minute, and let that run for 3 to 5 minutes. After giving either the bolus or the infusion for 3 to 5 minutes, they then recommend starting a maintenance at 25 to 75 mics per kg per minute. Another way of providing moderate sedation is dexmedetomidine, otherwise known as Precedex. You can give that at 0.2 to 1 micrograms per kilogram per hour. It's important. And typically people will load half a mic per kilo. Those are the most common ways to provide moderate sedation. The last, but not as common way, is using ketamine. Ketamine you can typically give at 0.2 to 0.5 milligrams per kilogram, Q10 to 15 minutes. That will provide decent sedation. It's recommended when using ketamine to give a benzodiazepine prior to its use to prevent the psychedelic side effects. I typically give 1 to 2 milligrams of midazolam prior. Hope you enjoy the lecture.